Hi everyone, it's Dr. Morris here with Magnolia Medical Center, and I wanted to come to you with a video today about diagnosis. All right, so we have lots of patients who come in and they say, "What's my diagnosis? What's wrong with me?" And I kind of want to make sure you understand what that question means, is because there's two different answers to that. There's the traditional medical model answer to that, which is a diagnosis is something that has you're basically giving a name to a disease or a set of symptoms. It can be sometimes very valuable. It can be very important. But in many cases, just giving a name to a set of symptoms or a disease answers nothing for the patient. It absolutely answers zero for the patient about what's wrong with them. If you had somebody who had, let's say, an infection, well, it's important to classify and understand where that infection is coming from, what type of bacteria is causing it, what type of virus, if they have a parasite, so what is causing that infection. And that's important. So if you got a diagnosis, let's say that diagnosis was you had a staph infection or a MRSA infection, or you had E. coli or what have you, or you had a parasitic infection in your liver or in your gut. Very, very important to get a good diagnosis with that regard. But for the vast majority of problems that are out there, getting a diagnosis does not change what's done for the patient. What I mean by that is, if I give you a diagnosis of an infection, or let's say you had a bladder infection, and we actually found out, we did a culture on your urine, and we found out that you had a bladder infection, it was due to X, Y, or Z bacteria. Well, that's important because it'll allow the doctor that is providing you with that diagnosis, what is the correct antibiotic to give to that person? Because some bacteria don't respond to certain antibiotics. So it can be important in that regard. However, what if the person has recurrent bladder infections? And let's say we find a bacteria, we even culture for it, we know what bacteria is there, we provide an antibiotic, not me obviously, but an antibiotic is provided, and the person keeps getting bladder infections. Well, then the diagnosis of a bladder infection doesn't do anything for that patient. So basically, we're just looking at a set of symptoms, providing a medication or providing a treatment that is supposed to take care of those symptoms without finding the cause. So the point of this video is, don't own your diagnosis. Don't own that diagnosis, because that diagnosis is, in most cases, not going to fix the cause. When I say in most cases, really, something's going to have to be done no matter what you have going on in order to fix it, even if it means changing your diet, getting a chiropractic adjustment. There could be many, many, many causes. But if you don't find out what the cause is, you're simply going to treat symptoms. You're going to chase those symptoms, and you can get you can call it whatever you want. You can call it. My father used to say that he had. My dad used to say he had lacunga. He used to work on cars, and he'd get his hands would look cracked and dry, and he said, it's a rare Brazilian contagious skin disease. Right after he shook somebody's hand, it was this funny joke. He'd made up the name of this disease simply because he had his hands in chemicals and working on cars and grease and things like that all day. So you could call it lacunga, you could call it whatever. But if you don't find the cause, the name of the disease does not matter. So don't wear your diagnosis. Don't own your diagnosis. Don't take the diagnosis from your doctors. Let's say they tell you that you have man, it's so common. My patients come in probably every day. It happens. Somebody says, well, I have a herniated disc in my back, or I have a bulging disc in my back. And you say, well, when were you told that? And they were told that 13 years ago. They were told they had a herniated disc or a bulging disc in their back based on an MRI 13 years ago. Folks, I'm probably rambling on here a little bit, but understand the statistics is that if we did an MRI of 100 healthy, pain-free adult individuals, 100, a full 40% of them are going to show on an MRI that they have a bulging disc or a herniated disc on an MRI, even if they're pain-free. Even if they're pain-free. So if you took 100 people that had some debilitating low back pain and they had an MRI, about 40% of them are going to show up and say there's a herniated disc or a bulging disc. So what shows up on that MRI may be totally different in even a few weeks, a few months. Definitely, it could be totally different in 13 years. So just because you were told you have a herniated disc on an MRI doesn't mean that that's the problem that you have to fix. So don't own that diagnosis forever, even if you've been given one. I hope that helps you. Folks, we want you to be healthy. Please retweet this, share this, get it out there on Facebook. People need to know this. They just can't go on their whole life with a diagnosis that isn't going to fix their problem. Thanks for watching. Really appreciate it. I'll be coming at you with more videos about health and healthcare and the healthcare revolution that's happening in this country right now. Super excited about it to be a part of that. Talk to you later.